sometimes focus a lot more on PCOS, hormonal imbalances, most of the demographics of women, because I talk a lot about intermittent fasting and time restricted feeding.
Absolutely.
So when we reset our circadian rhythm, the hormones get back to
Change.
normal
Absolutely.
sometimes. And women are getting affected a lot more because of the change in the circadian rhythm. And I always feel like the infertility rates or the PCOS problem may be connected to this hormonal imbalance as well. In your experience, how's this PCOS symptoms and incidence compared to before?
See, I've been practicing for 2 decades now. So, what I can tell you is the idea of PCO is now well established. Earlier, maybe there was some less diagnosis happening, so we really do not know about the incidence 2 decades back. But today, in my practice, I'm sure that 3 out of 10 women who come to us for infertility would be having an underlying cause of PCOS. If you talk about around 2 decades back, that would have been maybe 1 out of 10. So there has been a 3 times increase in the PCO incidence, is what I would say on a very conservative basis. I would say that this is kind of related to the diet, as you mentioned, sedentary lifestyle that we nowadays have, and also to the fact that maybe the pollution and everything put together, that's kind of affecting the hormonal rhythm, as you mentioned, and affecting their health. So,
And the patient seeking for infertility related treatments, has it gone up or is it the same?
yes, no, 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 much higher,
higher.
much higher. So, World Health Organization last year, they published a data which unfortunately did not include India as such. But overall, the worldwide, they said 1 out of 7 couples are now suffering from infertility. That is, couples wanting to conceive but not able to conceive. And we have kind of related data from our country as well, Southeast Asia, and this is pretty much the same or maybe even higher. Unfortunately, as you understand Indian context, the reporting is not as robust as you would want it to be. So, and there's something called the secondary infertility, where you have a child and you're wanting a second child, but you're not getting pregnant. Most of these couples still haven't gotten around to consulting doctors, and therefore the data doesn't get captured. If we look at the whole picture, I would say it's something like 1 in 6 or 1 in 7 couples in our country as well, which is sad because India is a young country.
In country, yeah, 1 in 7.
1 in 7 couples.
Do we have any data which are in terms of, there is a separate category called male infertility?
Absolutely.
It is
absolutely.
not only females.
Absolutely.
Previously, when I was doing medical school here, whenever there's an infertility problem, we look down upon the women as if that is the worst thing that happened to her.
Absolutely.
Has that changed, and are we open to considering male factors as well?
No, good that you talk about this. To be very honest, again, and I studied in medical colleges in the 90s, and we never had something called male infertility. So, and we were told that infertility is basically a women's problem, and that's how you should deal with it. In fact, even now in most medical colleges, the infertility section is part of OBGYN, so which is kind of a illusion that if women do not get pregnant, it must be something wrong with them. But honestly, and I'm telling you this is from my practice and also from colleagues that we talk all the time, 50%, that's 1 in 2 couples who do not have children, are directly, indirectly related to the man.
Wow.
The man could be like not having good quality sperm, could be sexual dysfunction, could be something else also. If we talk about the PCO in women, there must be a male equivalent which we're not aware of. Maybe diabetes, maybe obesity, maybe something else. So all put together, there is definitely this understanding that the man is equally, if not lesser, responsible for the infertility demon that's now affecting our country.
When a person listening to this podcast, so let's say they want to know more about the infertility treatment options, at what time that they should come to an infertility specialist?
Okay, so see, first of all, infertility is never an individual diagnosis. You have to exist as a couple, try for a baby for at least a year, and we call this regular, unprotected, penetrative, ejaculatory intercourse to define it on a regular basis, which is basically twice a week at least. And if you haven't succeeded to conceive in years' time, that's when you can consider that you're suffering from infertility, and that's when you see a doctor. If you are older than 35, then the 1 year wait may be a little too longer for you to seek help. So for you, maybe 6 months is a good time for you to seek help. But otherwise, it's a year's time of trying, and if no pregnancy, then go and see a doctor.
And I'm going to ask you a controversial question.
Absolutely.
And if you're not comfortable, please feel free to ignore. What is the best age for a woman to get pregnant?
Okay, so the politically right answer is when she feels like it. So of course, as we keep saying in our social discussions and in the academic conferences also, women have evolved, and we cannot shy away from this fact. They have an equal right to studying, to a career, to financial independence, and you cannot take that away. They're just not only meant to bear children. So much so that even today, we first need to recognize that her primary right is to exist as an individual and not as a mother. Having said that, we also need to look at the human physiology. Men make sperms throughout their lives. So, technically speaking, they're capable of fathering children even into their 60s and 70s. It's another situation where as you grow older, the sperm quality worsens, and that's a different topic. But unfortunately for women, they're born with a fixed number of eggs, and that cannot change. And almost on a daily basis, they're exhausting their eggs. We put a number of something like 30 odd eggs are going waste on a daily basis. So she's using up almost 1,000 eggs a month. And she was born with a fixed number of eggs. By our estimates, she has around 400,000 eggs by the time she started her menses.
I see.
So that translates to maybe 400 menstrual cycles. Now, by the time she's 30, she's used up 3/5 of those eggs. Now, if she doesn't get around getting pregnant, then maybe by the time she's willing to become a mother, she would have used up most of her good eggs. And that's a warning that we are kind of bringing out in the fore with people like you through your podcasts, that people should understand that this is what the female biological clock is all about. This is not to be confused with their independence to become parents or mothers as they may want to. One way of handling this could be if they could go around and freeze their oocytes at the right time. But that we also understand is a socially evolving concept, and we cannot really impose this on a general population just right now.